This is leap year, and we get a bonus day for Black History Month. Welcome to Black Health Matters. I'm your host, Dawn Daly-Mack, RN, and today we'll explore how biases impact patient care, perpetuate disparities, and what steps we can take to create a more equitable healthcare landscape. Stick around as we unmask racial bias in healthcare. To help you understand racial bias, I'll give you some definitions. Racial bias occurs when attitudes and judgments based on race influence decisions and behaviors. Implicit bias is an unconscious stereotype that shapes how healthcare professionals treat patients. These biases affect diagnoses, treatment options, and overall outcomes. Some specific instances. Research shows that implicit racial bias affects both treatment decisions and clinical judgment. Two things that brings to mind for me. One is pain. It was a long held belief that Black people had a higher tolerance for pain than white people. So, when someone came to a doctor or into a hospital complaining of pain, it was believed that they were lying and that they were really just junkies looking for pain medication. Let that sit there for a while. So, people that were experiencing severe pain for whatever reason were not treated for their pain, and probably the source of pain was not even sought out because they were just junkies. Get them out of there. And another thing, diseases like multiple sclerosis or MS. It was a long held belief that Black people didn't get MS. So when someone presented with the signs and symptoms of MS, usually MS is the last thing that they are assessed for. And so people with MS of color often ended up with more debilitating because they don't get treatment, they don't get medication. And oftentimes, when someone has MS, the last thing that you hear is that, well, they're gone now and they had MS. That's been my experience with people with MS in our community. Health disparities. The reality is, communities of color experience worse health outcomes despite efforts to bridge gaps. The evidence is incidence, prevalence, disease severity, mortality rates, and care quality all reveal health disparities. At the root of this is structural racism and health inequities. The root causes are socioeconomic factors that intersect with structural racism, and ethnic minorities face poorer health outcomes. Like during COVID 19, oftentimes there were complaints that people of color were not being tested and were not receiving vaccines once the vaccines were made available. And it was up to ethnic minority healthcare workers to bear the brunt of this reality, as we were the only ones that would go out into the community and make sure that people received the tests and the vaccines that they needed. Now, of course, there's always a historical context. African American individuals historically receive fewer procedures and lower quality medical attention. You see, without insurance, you're probably not going to get all of the tests that someone with insurance would have. You're probably not going to get all the best medication that someone with insurance would have. So, poverty is definitely an indicator of the type of healthcare that you're going to receive. But a lot of that is based on bias. How can we address this? Well, education and awareness, like listening to Black Health Matters, and also researching for yourself. But also, healthcare professionals must recognize their own biases. Training programs can foster awareness and cultural competence. And about cultural competence, I once heard that you really can't be culturally competent, not with somebody else's culture, but you can try the best that you can. There need to be systemic changes. Institutions should actively combat bias at all levels. And diverse representation matters in leadership and decision making. Now, there's a whole lot going on around DEI, diversity, equity, and inclusion these days. Um, but actual representation, not just putting a face there to say, hey, we got a black person, or we got an Asian person, or whatever the flavor is, real representation in leadership and decision making. And then there's patient advocacy. Patients should advocate for themselves. But how do they do that? How do you advocate for something that you don't really understand? And so I'm really happy about a profession that has come to light that is really growing in popularity, and that would be community health workers. Community health workers are just that. They are people in the community. They're not doctors, they're not nurses, but they are people that advocate and help to educate people in their community. They can be from any background, but just have a care for other people. And so we have some here in our community, and it is really just a growing thing across the nation, and it's a beautiful thing to behold. But we also must seek culturally competent care. We have to demand providers who understand diverse backgrounds. And preferably, if they can actually be from those backgrounds, then they would really understand. Community engagement. No longer can we just sit home, sitting on our hands, and say, woe is me, I'm not getting no help. We have to get involved. If you don't know, ask questions. I tell you every week, if you have any questions about anything that I have shared, call me at 252 410 1717. And so, in a conclusion, there's a call to action. Let's dismantle racial bias together. Every patient deserves compassionate, unbiased care. Healing begins with awareness and action. And as always, I remind you that Black health matters.